pathways or transferring into the Bachelor of Nursing. So I've finished the diploma, what's next? Some students may be very happy at the end of their diploma to obtain their APRA nursing registration and enter the workforce and discontinue study. That is fine. You can also leave your options open, and if you leave your options open, you may decide to take 6 to 12 months leave of absence. You can also continue directly into the Bachelor of Nursing in conversion. If you're eligible for transfer, there is a process to transfer you from the Bachelor of Nursing Foundation program into the Bachelor of Nursing program that leads to registration. We need you to produce your certificate of completion and results for the diploma. We also ask that you obtain APRA registration as an enrolled nurse. Your APRA registration can be pending as long as your TAFE has provided a letter of completion. You also need to complete the provided course transfer online form, and it's really important that you check your emails in the last few months before you complete your diploma, because this is how you receive your offer and your requests for documentation, and it's also the process for returning your forms online. You also, as part of the transfer, undertake a transition subject, NSG2 TBN. All documentation must be returned to Trobe University. When you've passed NSG2 TBN, that allows you to progress into semester 2, year 2 of the degree. So it is a hurdle subject. Your classes for the Bachelor of Nursing EN conversion program are held at a La Trobe campus. At this point, you start paying CSP or university fees. You also complete an additional of 1.5 to 2 years of full-time equivalent study, depending on whether you study full-time or part-time. But you could, if needed, also extend that and complete that over 3 years if needed. This program, the Bachelor of Nursing EN conversion, is fully accredited by ANMAC and is recognised by APRA. You will be eligible on completion for registration as a registered nurse. One of the key features of university year is that we run on 2 12-week semesters. This doesn't seem like much in terms of the weeks at university, but there are large amounts of study required in each of those 12 weeks. So what are some of the main differences between university and TAFE? One of the things a lot of our students say is they really notice the academic integrity expectations are higher for referencing, and not just the fact that you do reference, but that you reference from sources such as research articles, and you don't over-rely on textbooks or websites. This means you do need to become familiar with obtaining good quality refereed research articles to provide evidence for your written work. University also doesn't provide you to hand in drafts or to resubmit assessment tasks. We do what is called summative assessment. Each subject may have 2, 3 or 4 assessment tasks, and all of the marks are added together. It is possible to fail one of your assessment tasks and still pass overall. It's very important with university assessment tasks to actually provide the very highest effort you can in each assessment task so that you don't face the risk of failing. We have more self-directed learning, but the self-directed learning is not you being left to your own devices. Our problem-based workshops give you lots of direction as to what to do to be prepared for classes. We also have a lot of online lectures. The advantage of this is that you can stop and replay them, and you also have notes attached to them so that you can spend more time understanding key concepts, or if it's material you already know, you can move through them more quickly. There is a higher level of critical thinking. Critical thinking actually requires you to use your judgment and knowledge of key concepts to provide understanding of a subject and to be able to provide advice to patients and to start formulating nursing care plans. We have more interactive workshops. Most of our rooms are set up with round tables and students work in groups. Learning from and with other participants actually promotes deeper learning. As I mentioned, we have a number of online lectures. There's also ability to pick your own workshops and lab groups. A number of the classes are run several times across the work week, and this gives you options to select a timetable on key days or times that best suit your needs. What is contained in the last 12 subjects of your university degree? As I said, normally there are 4 subjects a semester. In semester 2, year 2, there are 4 15 credit point subjects that cover subjects like chronic illness, acute illness, Indigenous and intercultural health, and health priorities. 2 of these subjects also include placement. An 80-hour placement or 2 weeks and 120 hours of placement or 3. So you can see that for a number of weeks in a 12-week semester, you're actually out on placement. In 3rd year, we have some double credit point subjects. You can see that it will say credit points 30. That means it's equivalent to the workload of 2 subjects. So in 3rd year, we start to specialise in terms of opportunities for less general nursing care and an opportunity for you to go to an emergency department or an ICU in a time critical situation, and also to have more in-depth understanding of mental health and illness. Both of these subjects have large clinical components. In semester 2 of your final year, there are 3 subjects, 2 15 credit point topics and a 30 point consolidation subject. The engagement in professional nursing subject provides you with a lot of information that employers are looking for in relation to your understanding of the workforce, the quality that underpins healthcare delivery, and your requirements to maintain professional registration and continuing professional development. The primary healthcare nursing provides you with an opportunity to visit primary and community settings, and the nursing consolidating subject is a large 5-week block for you to actually be signed off for all of your nursing core competencies. And this can be undertaken in a variety of venues. Why university study? There is a significant shortage of Division 1 nurses. The scope of practice provides you with opportunity for postgraduate, and a number of students who enter a Bachelor of Nursing are really keen to go on to specialise, whether it be midwifery, theatre, intensive care. There are many options. You can also work as an enrolled nurse whilst completing your Bachelor of Nursing training, and you can maintain your enrolled nurse and your registered nurse registrations as long as you're able to demonstrate competency in both of those areas on an ongoing basis. You will have already completed university subjects that provide credit for the Bachelor of Nursing in the future. If you do decide that you don't want to continue with the Bachelor of Nursing conversion program, You will have gained 11 subjects at university. These remain current for a number of years.